So here at the Baton Rouge Clinic, we provide travel advice. So we have an official travel clinic. What one can expect in a travel medicine clinic is typically the advice you need for something such as a mission trip. Some people are planning a safari trip of a lifetime. I've had folks come in for planning for a trip around the world, or even a cruise down to the Nile in Egypt. So these are a few of the things that people tend to come in to see us for. So what they can expect from a visit, typically 30 to 40 minutes. I review your medical history. We look at your trip itinerary, all the specific things there. And what we do is we make recommendations based on where you're going, what you're doing, and what your healthcare needs are. So that includes immunizations. We see what you've had before, what you need. We see what your risk factors are. We cover things like insect precautions. What that means is if you're in your malaria area, potentially yellow fever, some examples, we will provide you with the preventative medicines, tell you what sorts of preventative measures you should take, for example, insect repellents, which ones exactly to use. There's so many out there. Things to minimize your risk for transmission of illness. Traveler's diarrhea is another thing we cover. You know, when you get sick, what to expect, what you should do. We also cover things like altitude sickness. You know, so you're hiking up to Machu Picchu in Peru or some other places. We can provide medications to help decrease the likelihood of that, and you know, again, things to expect in those areas and those kinds of trips. We'll also do work travel trips. Some people have to go overseas, Asia, for months at a time, or even a couple of weeks at a time, and we provide the immunizations and the medications, sometimes contacts for places in those places to get health care if they need to. So those are the typical things we provide. Other things we talk about are safety, you know, COVID issues, now that we live in a different world, post-pandemic, what the requirements are in certain countries. We cover all those things. When you come in for a consultation, it's very specific to your itinerary. Again, looking at your whole medical history, what vaccines you've had, what future trips you may do. We make prescriptions for those medications. We give you prescriptions for the medications. We give you the shots at that visit. We monitor, of course, for any adverse effects. We talk about all the risk factors involved with that. But yeah, the typical places that people come in for, you know, like I said, Peru, hiking trips, safaris to Africa, are some of the things, work trips to Asia, cruise ships. Some people even going to Europe have come to see me. We talk about what the risks are in those specific places. We'll look at a map. I'll give you the maps of those areas where there's risks for different things. There are not very many clinics in the city that do this. So we are an official yellow fever vaccine provider. At this point, I don't know if there's more than one or two available in the city, specifically given by a physician here at the Baton Rouge Clinic. So we do provide those vaccines that you can't get at a health department like you used to. So we do provide those vaccines that other places don't. And then we do try to run things through your insurance as well. That's something that sets us apart from other places you might go get travel advice. In this case, it will be from a physician. If you need a consultation for travel medicine for your trip, the first thing to do is you would call your primary care doctor and see if you need to see a travel doctor. And what they'll do is they'll connect you to our clinic, which is here at the Baton Rouge Clinic. You just say, I need a travel medicine appointment myself, and there's another physician who provides that. If you're in the system, you know, we should have all your records as far as shots and all, but if you're not sure, it's always good to bring your shot records with you.